In this video, you can see the patient is unable to lift his hand to the upside. He is a known case of frozen shoulder. Soon after the Ayurvedic treatment, he can completely lift his hands to the upside. So in this present podcast, we will be in length discussing about the Ayurvedic management of frozen shoulder.
Sir, nowadays we are seeing a lot of frozen shoulder cases in OPDs. What are the causes and what should be our approach towards it?
See, frozen shoulder, we compare it with the Ayurveda terminology like avabahuka or apabahuka. So, it is also compared with the tendinitis of the shoulder joint. So the causes comes like there are so many causes, such as one is the shoulder cuff injury. Generally we see it may be post-traumatic, it may be post-surgery where the patient keeps the shoulder without any motion for so many days, or any fracture of the humerus. These are all the conditions which cause the frozen shoulder. But generally the main and the most common cause what nowadays we are seeing for the frozen shoulder is the diabetes. So that is one of the very important area where we have to see, because all the patients of diabetes, most of them are getting frozen shoulder as one of the complications. So see, in Ayurveda we call it as avabahuka or the apabahuka. The verse goes like amsa moola sthite vayuhu sira sankocha tatragaha bahu prastandita haram janayati avabahukam. The Vagbata very clearly says the vata prakopa which is taking place in amsa pradesha, which is causing sankocha of the sira and sandhis, the siras, the tendons and the muscle insertion, whatever is going on in the shoulder joint. Those all things are getting shrunken. So the same thing what in modern science is. So here the approach towards, as you asked, like what should be the approach in Ayurveda. So Ayurveda having definitely a very good end in treating avabahuka, because in modern, the so-called modern, what they say, allopathic treatment science, what they treat it is with the corticosteroids and some NSAIDs, which may reduce the inflammation and the pain will relieve, and they also quote that it may take more than 1 year to completely resolve. But whereas in Ayurveda, even though after the corticosteroids and the NSAIDs, the condition remains, so many people won't get rid of that. We have seen so many such cases who are coming to OPD with the 1 or 2 years of treatments of other pathies. But where we have the good edge in Ayurveda, see, the Chikitsa Sutra, what the Acharya says is avabahukam hitam nasyam snehascha uttara bhaktika. So the treatment approach in Ayurveda is towards nasya, that is urdhva jatrugata vikara. So nasya is the line of treatment. So the putting medicated oils in the nasal cavity, we start the treatment, and the treatment approach I can divide it into the two types as such. One is treating the apabahuka which is in amavastha, and other one is in niramavastha or the pakvavastha. The vatavadi chikitsa, how it goes like upastambhita vadi and nirupastambhita vatavadi. Upastambhita is where the ama is present, nirupastambhita is where the amapachana is already taken place. So in such conditions where there is ama, where there is association of ama, and ama is nothing but inflammation, isn't it? So those things we have to trigger first, tackle first. So treating the amavastha of avabahuka is totally different from treating the pakvavastha of avabahuka. I will show some of the videos after this session in the video where we have treated the amavastha of avabahuka, and soon after the treatment the patient raises his hand up completely. It resolves completely. So in this condition of avabahuka, we have to treat with amapachana aushadis, ushna guna aushadis, tikshna aushadis, and sthanika chikitsas like valuka sweda, upanaha, and ushna chikitsas as such, and lepa as such. So after the amavastha comes down, then you have to do brahmana. So that is the line of treatment how it goes in amavastha. But so many patients who come to us are already in Dhatukshayavasthas. So there we need to do little Langhana Chikitsa, little Amapachana Chikitsa, and directly go for the Brahmana line of treatment. So there comes the role of Uttara Bhaktika Snehapana. So Uttara Bhaktika Snehapana is nothing but giving the medicated ghee after the food. So that is Uttara Bhaktika Snehapana. We usually give the ghritas which are anti-inflammatory, such as Gugula Tiktaka Ghrita, Mahatiktaka Ghritas. Because Tikta Rasa is again good for Asti Brahman. Asti Ashranam Vadinam Panchakarmani Veshisham Vastaya Tiktako. So there the Tikta Rasa is very dominantly should be used. Then coming to the drugs which we use in Avabahuka Chikitsa, which is such as in Amavastha, we should use the dragas which are Amapachana. At the same time, the condition should be improved by Amapachana, such as Gugulu Tiktaka Kashaya we use, Rasna Saptakam Kashaya we use, Rasna Shuntyadi we use. So such dragas which are Vata Kapahara and Amapachana we use in the initial time. Then along with that Yogarajam, Rasa Ushadis like Vata Gajankusha, Ekangavira. So such line of treatment should be carried out till the Amapachana takes place. So in the Sthanika, you use Aluka Sweda, you use Lepa, you use Upanaha, and you use Dharas, like management you will do. Once that avastha comes to the Nirama avastha, then we go for the Brahmana line, like Prasaranyadi Kashaya, Ushna and Brahmana. And you can go for Mahatiktakam, you can go for Maharasnadi, and you can go for Trayadoshanga Gugulu, you can go for Ksheerabala, you can go for Avartita Taila such as Ksheerabala and Dhanvantaram. So even the Nasya also we have to change that. Before we use, in Amavastha we use so many Tailas such as Karpasastadi Taila, Prasaranyadi Taila for Nasya. Then Parinita Keri Kshira Taila, such things. So in the Niramavastha we go for again Dhanvantaram or in Ksheerabala Taila, like that. So the entire Chikitsa is nothing but Vatavedi Chikitsa, Upastambhita and Nirupastambhita Vatavedi Chikitsa only. But only thing here we use is more of the Grita and Rasayana Chikitsa.
So now we have explained in detail about medicine. Now what is the role of other procedure like Agnikarma and Rakta Mokshana in this condition, and what is the role of physiotherapy in this condition?
Of course, Agnikarma and Rakta Mokshana, they are very important tools to manage this Avabahuka. Because Rakta Mokshana and Agni Karma, Rakta Mokshana is told as Ardha Chikitsa in Ayurveda, and Agni Karma it is told as Tadagdanam Roganam Apunarbhava. So Rakta Mokshana when to do and Agni Karma when to do is the question actually. Everybody does both the things. But see, when there is Rakta Varna, Vata Prakopa, then we have to go for Rakta Mokshana as the treatment. How we will understand it is Rakta Vrata Vata? Then you have to search in the Shastra what are the Lakshanas of Rakta Vrata Vata. So there you will get the Lakshanas such as Daha, Toda, Paka and all other things. So Rakta and Pittaja Lakshanas will be there in the patient along with the frozen shoulder. So there you have to go for Rakta Mokshana. And when the patient comes to you in Dhatuksha Avastha only, then for the management of Vata, we have to go for Agni Karma. So nowadays the Agni Karma can be done with the Swarna Shalaka and the Loha Shalakas nowadays. So it is in trending, Agni Karma is in trending. So other than that, the Panchakarma procedures we have already discussed like Nasya and Sthanika, Abhyanga, Svedas, so many Sveda modalities we can use like Potali Svedas and all. So of course physiotherapy will also help in that condition. So physiotherapy is the treatment where we do it to improve the mobility of the patient, isn't it? So the mobility of the hand will be improved by physiotherapy.
Now, what are the useful exercises we can perform?
So the exercises should be in such a way that there should not be any tissue damage further. So only the exercise should be performed to improve the mobility of the shoulder joint, such as revolving the hand. Nowadays in parks and all, you are seeing that instrument by which you can rotate the hands. So such kind of exercises can be done regularly, and the patient should avoid throwing something like taking the stone and throwing somewhere and balling, such kind of things, and lifting the heavy weights, lifting the bucket full of water. So such conditions should be avoided. Other than that, even in Ayurveda we will get the very wonderful results without using any steroid medications. With the pure herbal and herbo-mineral combinations, we can achieve very great extent of the mobility in frozen shoulder-like conditions. So I think that should be enough information about the frozen shoulder. Thank you.
Thank you, sir.